at the University of Houston Graduate College of Social Work, and I am presenting on ADHD beyond the DSM. The objectives of my presentation are to first give an overview of ADHD. It will evaluate the DSM definition, as well as a lot of the other presentations, expectations, and associations of ADHD. We'll talk about ADHD facts. We'll discuss the relation of ADHD to executive function. And we'll also talk about medications and the limitations of medications. And finally, we will evaluate CBT treatment for ADHD. So what is ADHD? The DSM defines ADHD as a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning. It can be presented in inattention type, hyperactive, impulsive type, or a combined type of both. The key is all of these criteria that are listed under both would have to be met in two different settings. So that can be either at school, at home, or at work. And as you can see by the age distinctions, you have to meet at least 5 if you're 17 or older. But if you are under the age of 17, then you would need to meet 6. So what does ADHD look like? Well, that really depends. ADHD is a lot like personalities. It can present itself in many different ways based on the person. For instance, a person that is challenged with focus issues, their presentation of ADHD may look a lot different than someone who is impulsive and can't stay still. And their definition or their challenge or their presentation will look a lot different than someone who really doesn't get social cues, has a hard time learning from their mistakes, and so on and so forth. So to give you a better idea of what ADHD may feel like for someone who is challenged with it and goes through it on a daily basis, imagine that you are sitting in this presentation and you are live, and I'm standing up in front of you making the presentation. But while I'm making the presentation to you, there is, let's say, a whisper in your right ear. Someone whispering all of the things that you may be thinking about with relation to you leaving home this morning. Or if you're at home, all of the things that you need to take care of. Did you turn off the water? Is the door locked? Is the security alarm on? Did you let down the garage? And just whatever you can think of, the things that may have possibly been left undone. Imagine someone's whispering those in your ear. And so while you're watching this presentation, and that's going on in your right ear, imagine in your left ear someone is shouting in a very loud volume all of the things that need to get done for work. You have, let's say, a meeting with your boss this afternoon. And in addition, you have a report that needs to be done by the end of the week. You have an assignment that you need to get to your group with all of the instructions for an upcoming project that needs to be done as soon as possible. You have your own presentation that you have to make in the coming weeks that you have to take care of. And someone's shouting all of those reminders in your ear while someone's whispering some other things in your other ear. And then let's imagine that during this presentation that you're close to a window, and out that window, say a bird flies by, and you're wondering what kind of bird it is, and then you're thinking about, well, what is the temperature outside? I wonder how that affects the bird. So all of these different random thoughts are coming into your mind about all of the things going on. In addition to that, let's say someone else is in this presentation or watching this presentation with you. And let's say that they're they're moving their feet and it's making a sound and you're kind of focused on that sound. It's not really annoying, but it's noticeable. So all the time that you're watching this presentation, all of these things are going on. Well, that's a lot like what it may feel like for someone with ADHD on a regular basis. But that's my description. And it may feel a lot different for you. So what I wanted to do was give you the opportunity to experience it for yourself. So I found an ADHD simulator online, and that will be what we will look at. And it should give you a better idea of the many challenges that are associated with ADHD. So that will be the next thing we do. It's going to be, there's a warning. First of all, if you are at a computer and you're listening to this presentation, hopefully you have headphones because it's going to get pretty loud. But also there's going to be a lot going on at the same time. Pay close attention because we will have a test afterwards on some of the things that you should have seen or should see in this presentation. Also, if you're wondering about the cat in the lower right part of the picture, I don't think the cat has ADHD. Not really sure. Don't even know if there is any information on cats and ADHD. I just wanted to make sure you were paying attention. So if you saw the cat, good job. That means you're ready to go for this video. All right, here we go. So you can imagine just going through that for, this video was 90 seconds. Imagine what it would be like going through that every day of your life. That could be a significant challenge. So next we have the test on the video that you just saw. So let's see how you did. First question, who decided to go shopping? Answer, John and Mary. What color are Mary's eyes? What bus number did John and Mary take to get to the supermarket? How far did they walk to the supermarket? How many pints of milk did they buy? Who received the change from the cashier? And the last question, what street do John and Mary live on? So I will have to admit that I have watched this video several times, and it was really challenging for me, even though I knew the answer after the first time or so, to find all of these answers every single time I watch it. There's a lot going on. And so hopefully it gives you just a good idea of what people who are challenged with ADHD face on a regular basis before even talking about medications or interventions. Okay. So if you're interested in what the numbers say, the CDC currently says that about 11% of American children are challenged with ADHD. That number is actually up from the APA report in 2011 that had that figure at between 4 and 5%. It's not permanent for most children. And what I mean by that is the prevalence rate is about 30%. So if you had a group of children and evaluated them over time, the research shows that by the time they were adult age, that approximately 70% of them would no longer report any type of ADHD challenges. ADHD can be comorbid in children that have other diagnoses like oppositional defiant disorder, anxiety disorder, dysthymia, minor depression, and there is a significant link between ADHD and PTSD. In fact, people with ADHD are usually at high risk or considered at high risk for the eventual development of PTSD. Now, the number in this presentation I have is about 2 to 5% prevalence rate, and there's a significant fluctuation based on which study that you look at. And I think that the reason for that is because there's such a stigma between both ADHD and PTSD that there's probably not enough data or enough people reporting that they have it to even be evaluated. So these groups for these studies are usually pretty small. The largest one I found was 25 people. Mothers of children with ADHD are 23 times more likely to have ADHD than mothers who have children without ADHD. The increases for ADHD are largest among women between the ages of 26 and 34 years old. And that information is from a company by the name of Express Scripts. They evaluate all of the information on all prescriptions in the United States. They also report that younger females between the ages of 19 and 25 have the highest use of ADHD prescription drugs. As far as geographic prevalence, as you can see by this particular map of the United States, there's a high concentration of ADHD in the southern United States. These darker areas, the dark red areas, are the highest prevalence, and the lighter blue, the least prevalence. So the number one state right now, or the state with the highest prevalence, is South Carolina, followed by Louisiana. Interestingly enough, Florida does not seem to have as high a prevalence as other southern states. When you look at the effects of ADHD with relation to education and occupation, the research shows that people with ADHD complete fewer years of education. It actually shows more specifically that of the people that are in school with ADHD, their GPAs can be up to a point or a grade lower. There's a higher dropout rate, so the graduation and retention rate obviously is going to be lower as well. Fewer people with ADHD enter college. The college matriculation is lower, so obviously the college graduation rate would be lower. More likely to be unemployed or underemployed, more likely to be fired or change jobs, and in general would have a lower socioeconomic status. Now, I would think the limitation of this research would be directly related to those who may be more affluent or may have access to treatment or prescription medication or good counsel with relation to the challenges of ADHD. So I did research at a high school, where a private high school in Houston, Texas, where the principal told me that their ADHD rate was approximately 22% of the students in the school had ADHD. And this is one of the best high schools in the country. So you would imagine that they probably don't have a dropout rate at all. And this is a school that sends all of their graduates to college. So their numbers will be significantly different. So it really just depends on the perspective and the situation. how would it present? So these are things that the research may or may not support, but these are things that I have in my experiences with ADHD, in my own family, in my own discoveries, have come across. No fear, willing to try anything. This one was also echoed by Chris Dendy in a presentation at this event. They don't always learn from their mistakes, and they make the same mistakes frequently. I always refer to that as kind of like the Groundhog's Day movie, where we're having the same conversations and the same discussions over and over and over again. So there's like a circular pattern of progress and regression. They seem to get it. Everything is going well, and all of a sudden they kind of hit the same pitfall and start all over again. Sometimes they refuse to acknowledge or employ logic or reason, because if something is just wrong, it's wrong. And that may have everything to do with the thought process or how they approach the challenges that they're faced with. Often appear to be uninterested or apathetic, and sometimes have extreme resistance to organization or structure. Dr. Brown in his presentation had mentioned that one of his students that he was working with had used this phrase to describe what it was like having ADHD. My mind is a great sprinter, but a lousy distance runner. And it really does kind of set the tone for the discussion about ADHD. It's sort of a working definition, a definition beyond the DSM. So with regard to a working definition, a definition beyond what the DSM tells us ADHD is, sort of a definition that we can think about as we approach our daily practice of working with clients that are challenged with ADHD. First of all, it's not about chemical imbalances in the brain. That was something that early research had indicated that it was directly a result of, but it's more about the neural connections. People challenged with ADHD did not have behavior problems. It has nothing to do with that, in fact. It's more about impairments in the white matter of the brain. Those areas of the brain that allow the different lobes to talk to and communicate with each other. It's about issues with short-term working memory. So it's not that they don't have the working memory. It's more about they have trouble retrieving it. So imagine that you study for a test one night. One of Dr. Brown's great examples in his presentation. Imagine that you study for a test, you have everything figured out, you've gone through everything from top to bottom, and you've got it. But then you go and you take that test the next day, and big chunks of that information are just gone. You can't find it, you don't remember it, it's just not there. And those are the kind of challenges that people with ADHD are faced with. Many of the people that are challenged with ADHD don't even have these issues until there's some type of stress in their system. So imagine that there's a child that goes to, say, public school and is a great student, a straight A student, has no problems. But then their parents decide to put them in a more challenging environment where the curriculum is more advanced so they can prepare for high school or even beyond high school, say college. So this new demanding environment may create more stress to the student, and that's when it may be evident that there may be some other things going on. The issues of focus can be hyper-focus. So like we talked about in the video earlier, it's not that you cannot focus at all. It's that you are busy either focusing intently on one thing or several things. It can be a lot of different things going on at a time. So it's not that you can't focus, it's just that you may not have the ability to focus on what needs to be focused on. These impairments can be situationally specific. So a good way to think about that is most people that have ADHD, if there's something that they enjoy doing, they probably have no problems doing that. So imagine it's related to sports. If someone really enjoys playing baseball, when it comes time for them to go to baseball practice or to play in a game, they probably have no issues, no challenges, there's no problem. But if they have something else. Let's say that they don't like Spanish class. Well, they may have some challenges with relation to Spanish class. They may have focus issues or impulsivity issues because that's not something that they enjoy doing as much. People with ADHD become proficient at managing emergencies. They actually become really excellent at it because if something's not important, they don't pay attention to it. If something they don't want to do, they don't pay attention to it. But when it gets to the point where it's an emergency, when it gets to a point where it has to get done and there's going to be a problem if it's not, that's when they're able to get focused on it and work at getting it done. ADHD has a direct link to the process of executive function. And executive function is basically the ability to connect and prioritize and integrate those cognitive functions that we have moment by moment, the things that happen in our brain or in our lives that require us to make certain decisions or accomplish certain tasks. It's an unconscious automaticity. The best way for me to describe that is to use Michael Jordan. Michael Jordan is obviously one of the greatest basketball players of all time, in my opinion. And so when you think about him, when he was in the prime of his career, let's say that he's on the court and it's game 7 and it's the finals and he has the ball in his hand and there's no time left. Let's say that famous, we'll say game 6, famous shot that he took. So when the pass was made and he received the ball, when he bends down to get ready to attack the basket and he looks up, he's not thinking about where to put his foot when he's stepping or running toward the basket. He's not worried about picking up one foot as the other one is going down. He's not thinking about exactly what area of the court to step on. He's not thinking about exactly how the ball is hitting his hand as he dribbles or when he pulls up for a shot. He's not thinking exactly how to place his hands on the ball or exactly where that ball needs to be released in the air in relation to where he is on the court. A lot of that is just automatic. Those are not things that he has to think about over and over every single time he does them. It's just unconscious. It's just something that happens over time. And that's the way that executive function works. It's the way that our brain processes some of the tasks that we have to do without specifically thinking about each step that needs to be done. Imagine a movie director. So if you are a director and you are in charge of a movie, there are a lot of different moving parts. You have gaffers that take care of certain areas. You have grips, you have sound people, you have cinematographers, you have other assistant directors, you have actors. You have all different types of people that have different things going on. And it's your job to keep all of that going and working together. That is a lot like executive function. It's pulling off all of those individual tasks to accomplish one specific goal. So another thing to think about with relation to executive function is this phrase: will you do it? And if so, how and when? It's a good way to kind of think about how executive function is directly related to what the task that we have to accomplish in our lives and what's going on in our brain and in our thought process. So the will you do it part is motivation and action. How you do it is the planning and the organizing of that task. And then the when is just the timing of the task and actually remembering to do the task. Some of the most significant research related to ADHD was the Shaw study. So the pictures in this slide give you a good idea of what brain scan or brain imaging would look like prior to the Shaw study. So these pictures can give a lot of information to scientists on how ADHD affects the brain. As you can see, there are two different brains, one control subject and one ADHD subject. But the limitation was that these scans really only evaluated the four areas of the brain, and they couldn't really get more specific. One of the things that happens in brain development, especially for kids that around puberty, is there is a massive proliferation of cortical brain cells. And what happens with these brain cells is they're growing at massive rates. And then what happens is there's what is called a pruning process. So just not unlike how if you have, say, a fruit tree and you prepare at a certain time of the year to get your tree ready to produce better fruit. You would trim the branches and you would do certain things so that when the branches grow back, they're manipulated to the point where they are able to produce better fruit. Well, the brain sort of goes through a similar process. So the differences in between how these scans that you see evaluated what was going on in the brain are much less revealing than the Shaw study can be pretty evident by looking at the Shaw study images. So the Shaw study utilized computer-generated images similar to the ones that you see here. These are actually some of the pictures from the actual report. Instead of using brain scans and images that reflected certain areas of activity through light from, say, an X-ray or a scan, the Shaw study used computer-generated images. And as opposed to only being able to evaluate the four lobes of the brain, the Shaw study was able to examine cortical thickness from 40,000 different areas of the brain, and it actually used 800 or over 800 different magnetic resonance scans. So the control groups were even larger for the study. There were 223 kids with ADHD in the control without ADHD, and then the control group was also 223 children as well. So what was discovered over this evaluation was, as you can see by the images based on the colors and the graphic at the bottom, that there are significant areas of the brain where there is either a 0 to 2 year delay, and then also several areas where there's greater than a 2 year delay in development. So this was a significant discovery. Obviously, it gave tangible proof that the development of children with ADHD, the brain development, was significantly different than those who did not have ADHD. And so as clinicians, it is very important with this, knowing this information is very important to understand an ADHD diagnosis. So an ADHD diagnosis will actually indicate, or should indicate, that there's a potential that there may be significant developmental delay issues. Now, that's not always the case, but if you are presented with an ADHD case, it's one of the things that you should be thinking about and might want to assess for. Also, knowledge of that childhood ADHD diagnosis can be useful in many ways. Knowing what we know now about ADHD and this delayed development, it can be useful to help you to determine how you can best help your client. With regard to the interventions for ADHD, the two main approaches would be medications and treatment. With medications, they've been shown to be very effective with regard to the treatment of ADHD. So here you can see the different types of medications. There are stimulants, amphetamines, and amoxicillin, which is a non-stimulant. And all of them have been shown to have an effect on ADHD. There's something that each one of these medications, through the research and through the trials, has been shown to have significant impact on addressing some of the challenges of ADHD. Medication treatment can help with addressing the challenges of ADHD in several different ways. For people that are challenged with focus issues or impulsivity issues, medication treatment has been shown to have significant impact. But there are other areas like time management and organization where they may not be as effective. At least the research has not shown or proven that they have had any significant effect or any effect at all for that matter. Another thing to think about with regard to drug treatment is it probably doesn't aid in things like development of metacognitive skills or skill training. It doesn't affect how clients deal with things like automatic thoughts or depression, maladaptive behavior. It doesn't really assess or address the psychosocial impacts of the challenges of ADHD. Those have to be directly related to other psychosocial interventions, specifically CBT. So at the CHAD conference that I attended, I was fortunate enough to sit in on a presentation from Dr. Mary Salanto. Dr. Salanto, I believe, is a pioneer in the area of cognitive behavioral therapy for adults with ADHD, and she's also actually working on development of an approach for children with ADHD. And so what I wanted to do was give you a little information on how her program works with people that have ADHD. It's basically a group therapy program, and it's specifically geared for both adults and right now adults and college students that are challenged with ADHD. So the way the program works is it is set up in the group format. And there are 12 different sessions. It's one session per week, and each session is 2 hours. So in these sessions, there'll be weekly handouts. They're generally designed for a group of about 6 to 8 people, and they're done in the evening so that people have time to, if they're in school, to get their classwork done. If they have to work, they do it after they have the opportunity to go to work, come home, eat a meal, take care of whatever other activities they need to take care of so that they can focus their attention on the session after all of that's done. So as you can see, the schedule is a review of a take-home exercise. Obviously, the first session does not include a take-home exercise, but after the first session, there's a review of the take-home exercise. There's a presentation and a discussion of new material. There's an in-session exercise, and then a discussion of the next take-home exercise. The selection of candidates for this particular program is important because the ultimate goal is to have all of your clients complete the entire group process. And so to do that, or the best way to ensure that, is to keep certain things in mind when selecting appropriate people for this group. The first is you need an official confirmation of an ADHD diagnosis. You don't want to assume that a person either has ADHD or has been diagnosed. You need to try to get an official diagnosis however possible. An individual consultation is also important. So in addition to having the diagnosis, you want to sit down and find out if this particular program is useful and why. It's not suitable for specific clients. Clients that have severe depression have been shown not to have success with this particular type of treatment. Any clients that have homicidal or suicidal issues also generally don't benefit. Clients with borderline personality disorder have been shown not to be suitable for this particular program. Clients with alcohol issues generally don't benefit, mainly because in most cases, the research for this particular program has shown that they just won't do the work. So if they're challenged with alcohol issues, they're probably not going to do the things that need to get done so that they can come back and present that or have that ready at the next session. Clients with anger management issues are also a challenge, mainly because they may antagonize other group members throughout the process. Other things to keep in mind is the program has to be interesting to all the participants. You have to find a way to make it interesting and keep people engaged. You have to make sure that you give all of the participants opportunities to manage their own schedules and give them strategies to manage their schedules. Otherwise, the exercises are not helpful overall to help them accomplish their goals. You need to make sure that you understand the challenges of ADHD as a clinician. And you have to understand if they have any other comorbid problems that may affect how they perform these tasks. Of course, you have to be a great cheerleader, and you have to be an excellent teacher. And another one is you really have to be patient. That's going to be a big part of this program. So we talked earlier about some of the exercises that are done in this particular type of CBT training. This is one example of Dr. Salanto's take-home exercises. This is a project flow chart, and this chart is actually in her book on CBT therapy for adults with ADHD. So in this project flow chart, if you notice to the far left, you have a due date for the project. So let's give an example of a project. Let's say we're planning a party. So the due date would be put in the box to the far left. And then the arrows point to all of the different, in this particular situation, there are 4 different tasks that need to be accomplished. So let's say the first task is to get food for the party. The second task, let's say that would be sending out invitations. The third task would be entertainment. And let's say the fourth task is, I don't know, what you're going to wear. All right? So you take all of these different things, so the food, then you go to the next step for the food. And all of these, if you notice, they have a target date to accomplish them. So for the food, now you've got a subgroup for what needs to be done for the food. And let's say that you need to actually go to the store and buy the food. Let's say you need to determine a menu before you even go to the store. Then you need to find a place to store the food, or you need a date to prepare the food, or you need to hire a caterer. Whatever those tasks are for that particular assignment need to be listed in that area. And so you can check those off as you do them. The same thing for the invitations, the same thing for the entertainment, and then for even what you're going to wear. So all of those things will be listed, and then you get in the process, or your clients get in the process of writing those things down and understanding where they are with regard to the order of everything that needs to be done. So this is a similar sheet. We won't go into as much detail, but it also is kind of a prioritization worksheet. So it gives you a task, a date, the time that you'll need, the priority for the task, what day you scheduled it, and what day you completed it. So there are obviously a lot of different exercises within this course that help people to be better at managing their time and managing their tasks. So another important part of this particular type of group therapy is having mantras. Dr. Salanto mentions often in her presentation the importance of mantras, just making sure that people understand that they need to believe in these practices that they repeat to themselves, because they're very important to accomplishing their goals. The first one is actually one that I kind of came up with as I was preparing this presentation. I'm one with my watch. I was able to attend several other presentations where people referred to watches. And one of the things that was said was the best reason for someone with ADHD to have a watch is it reduces distraction. So you imagine if you only use your phone to tell time, imagine when you check your phone for time, how many times you go to check emails, you go on the internet, you mess with an app or whatever else. So having a watch would allow you to just tell time and only tell time and nothing else. If it's not in the planner, it doesn't exist. So a really big part of this whole CBT process for ADHD is writing things down and sticking to a schedule. So that's very important. If I'm having trouble getting started, then the first step is too big. That's critically important. for obvious reasons. All things must be done in their order and in priority. So both of those sheets, as you notice, make it very clear and very specific about how things should be done. Getting started is the hardest part. A place for everything in its place. So all these things, out of sight, out of mind, just help someone to reinforce the things related to ADHD, a CBT approach, how to think of things logically and orderly. Other things that are important or can be useful in this particular CBT approach is CBT language, therapist language, related to directly to sort of the CBT Beck approach, perfectionism. So if a client says something to you about not being able to get something done or procrastinating, you can kind of counter that with, I wonder if that was your all or nothing thinking getting in the way. And so there are other areas, like in the area of depression and self-doubt and oppositionality, you can sort of use those same CBT approaches that you have come to kind of understand and employ in your practice. You can use those when you meet with resistance or there are problems within this group setting. So lastly, I just wanted to give you two great resources. I had the privilege of sitting in on presentations from both Dr. Thomas Brown and Dr. Mary Salanto at the CHAD conference, and they presented a wealth of information. But luckily, both of them do have fantastic books that are available for your review, and I encourage you to pick up a copy of both of them. They're really good information. They both possess really good information on how to approach ADHD, how to think about ADHD, what people that have ADHD are challenged with. And so they're really good reads for clinicians, and they're really helpful and will really inform your ADHD practice. So that's pretty much it. Here are my references, and I appreciate you taking the time to look at this presentation, and good luck to you.